Well, the Food and Drug Administration may soon give the green light. This is to allow people to receive booster shots that are different from their first COVID-19 vaccine doses.
Joining us right now with more is Dr. Mark Jarrett. He's the Chief Quality Officer at Northwell Health. Nice to have you on Good Day New York.
Good morning. Thank you for having me.
So booster shot, everybody's contemplating whether they need it, should get it. You know, we are talking about General Colin Powell. There are reports this morning that he was supposed to get the booster shot last week, but he was sick. You know, he's been battling cancer and other ailments. It just goes to show you people at a certain age need to know that they are still vulnerable if they've been fully vaccinated.
I would agree with that. Clearly, we don't know what cancer, what type of blood cancer Colin Powell had. And it's unfortunate that he succumbed to COVID. But that group of people who are immunocompromised are certainly at risk. And certainly those of advanced age are at risk. And therefore, based on the data we've seen, especially from Israel, older people should certainly be considering taking the booster, especially now that probably the other companies will be approved for boosters by the end of the week.
So you're talking about older people definitely taking the booster. What about the rest of us?
I think it's wise to take the booster. There really is no downside. Unfortunately, we've seen across the country a lot of COVID in young people. We've seen deaths in young people. Yes, they're not frequent, but you know, if it was anything else, we would be quite upset if we were seeing deaths in young people. We're seeing children get ill, more children than before. So protecting as many people with as much protection as we can do is the best thing. And doing boosters is not unusual. We do boosters with many of the vaccines that we take normally. If you get your tetanus shot, you get a booster every 10 years. And in fact, if you accidentally step on a rusty nail after 5 years, you get a booster right away if you go to the emergency room. So this is not an unusual thing that we do in medicine.
So, Dr. Jarrett, as these are working to be approved quite soon, the government is not promoting one booster over the other. However, we've seen studies that show some work a little bit better when mixed with something else. Do you, I guess, support one over the other or advise people to get one over the other?
I think the data is good for all three types of vaccines available in the United States. I don't think there's a big enough difference that at this point people should switch to another vaccine. There is some information coming out that perhaps mixing vaccines may actually give a better immune response. The data on that, unfortunately, is still in a small number of people, so we really can't be sure. But that is something that we've done in the past. For example, the Ebola vaccine uses two different types of vaccines, two different preparations. So it is things that have been done in the past. At this point, I would tell people, till there's more literature, if you had a Pfizer, get a repeat Pfizer. If you had a Moderna, get a repeat Moderna, etc. But if you accidentally got another one or made the decision to mix and match, I don't think that there's any probable harm in it.
And as of right now, I know it's just advised for people 65 and older, but I think we may all know someone that's not, you know, at the age of 65 that has just gone to get one because it's very easy to still go get one. So what are your thoughts on that? People under 65 going to get a booster shot as of right now?
I think people, you know, we have to follow whatever the emergency use authorization by the FDA and also what the Advisory Committee on Immunization Practices, which is an independent group of physicians, what they decide. We will get those final recommendations probably late on Thursday or Friday morning. Certainly people who have multiple medical conditions or perhaps just like they approve with the Pfizer, are in situations where they may be easily exposed, such as certain essential workers, healthcare workers. It probably would be wise for them to get boosters if they could.
Can we talk a little bit about COVID in kids on Long Island? Because we're seeing a little uptick with children there. What do you think is going on there, and how serious is it?
I think it's not panic time in terms of seriousness. However, any child that gets ill is not good. We all know we don't want any of our children to even get a cold if we can help it. And this can be more serious there. We don't know the long-term ramifications of getting COVID. Most likely the uptick is related to the fact that schools are open and quite frankly, children are interacting and playing with each other much more than they did, let's say, last year. Plus, we have the Delta virus, which appears to be more transmittable. So those combinations are probably causing the uptick. But we would expect that hopefully should start to go down as, number one, more people are immunized, and number two, we're hoping that this was just a small blip. But in other parts of the country, we've seen children affected as well.
Dr. Jarrett, do you think that we're going to have to all scramble to get that booster shot like we did to get our first shot, you know, months ago, where we were up in the middle of the night, logging in, trying to find a place? You think that's going to happen this time around?
I do not think that's going to happen. I think people are asking for boosters. We see it with our healthcare workers. But there's plenty of vaccine available. You now can get it at your local pharmacy. Many providers, physicians, nurse practitioners are providing it in their offices. So I think it's much easier to get the booster than it was to get the original vaccine. And again, people are protected. If they wait an extra couple of weeks to get a booster, in most cases, they're not at such high risk that really is a danger for them. So I don't think we're going to see that scramble we had, early in the year.
All right, Dr. Mark Jarrett, Chief Quality Officer at Northwell Health, thank you so much for coming on. Good day.
Thank you.